Good evening and welcome. My name is Patrick Gaskin. Welcome to our first Cambridge North Dumfries Ontario Health Team Town Hall, Community Town Hall. We're very excited for you to join us today for that and give you some important updates on COVID and the situation as it relates to COVID in our communities for that. Next slide, please. First of all, I come to you from Cambridge Memorial Hospital, so I thought it would be appropriate for you to hear the land acknowledgement that we use at Cambridge Memorial Hospital. Cambridge Memorial Hospital is a place of community, healing, and peace. We acknowledge and express gratitude for the opportunity to meet, work, and offer healthcare on the traditional lands of the Anishinaabe, the Haudenosaunee, and the neutral peoples. Our hospital is located on the Haldimand Tract. After the American Revolution, this tract was given by the British to the Six Nations of the Grand River and the Mississaugas of the Credit First Nations as compensation for their role in the war and for the loss of their territory in upstate New York. Today, very little of this tract remains under their control. I thank the Anishinaabe, the Haudenosaunee, and their neutral peoples for hosting us on their land. Next slide, please. So we have a great lineup of speakers for you tonight to give you the latest on COVID-19 and our community's response, what you can do. And first and foremost, we're really here to answer your questions. As members of our community, lots going on, and we really want to make sure that there's opportunities for you to interact and for us to answer your questions. To that end, the chat is always open, and so you're welcome to put in your comments, your questions for that. We have our great team from the Cambridge North Dumfries Ontario Health Team who will be monitoring the chat for that. And then at the appropriate time near the end, we'll go through and do some question and answers and be able to hopefully cover the questions that are important to you. Myself, Dr. Sharon Ball, Dr. Dave Arnott, Paula Carrera, and Helen Fishburne are your speakers tonight. I won't go through and read out, you can see on the screen where they come from and the expertise. I think if I add it all up, there's probably a few hundred years of healthcare experience behind tonight for that. And we're excited to bring that to you and be able to share with you some of the goings on. To that end, could I see the next slide? And we'll talk about the topic areas that we're going to cover. We're going to give some updates on COVID-19 and the current state of it. I'll speak about the hospital update as well for that. Dr. Dave Arnott will talk about where to test and about assessment or what to do if you're experiencing symptoms. Paula will talk about the importance of vaccination. Helen will cover your well-being and taking care of your mental health. And then we'll get into the conversation and the questions and answers that you may have for that. And to that end, I'm about to pass it over to Sharon. What I want to just say to you all is one thing that this pandemic has taught us is the system partnership and the importance that we have as working together in the system. And that wouldn't happen without some of our local government officials to help and give us a special welcome and help us who have been at our side along the way. We have the Mayor of Cambridge North Dumfries, Mayor of Cambridge, and the Mayor of North Dumfries with us tonight. I'm going to do them in alphabetical order. I wasn't sure which alphabetical order. Is it alphabetical order by city? Is it alphabetical order by first name? Is it alphabetical order by last name? But Mayor Foxton turned on her camera, and I was going to do it by last name, Mayor Foxton, for that. Mayor Foxton, would you like to bring some greetings to the group gathered tonight? I'll pass it over to you.
Not necessarily greetings, but thank yous. Thank you for the committee for doing this, because people are still afraid. They're still unsure. And thank you for those that came on today and are ready to ask the questions, because we can't move forward until we know the direction we're going. And once the answers are there, we can move together. And that's what we're doing. We're moving together. Thank you so much to this team. This team does so very much for our communities. And I know you're tired. I know everybody's tired. So tonight, I want you to listen. I want you to take a deep breath, feel the oxygen going to all parts of your body, and let's get control, because that's what's happening. We're taking control. We're going to beat this. We're going to do it together. And as I said, by mid-February, this is all going to be just a memory. So thank you so much for having me here. I'm so glad to be here. Great to be here with you wonderful people, and we're going to have a great night.
Thanks very much, Mayor. And you're absolutely right. We will prevail. We will get through this. Mayor McGarry, second in alphabetical order for that, but no less important. Would you like to bring greetings or kind words to the group?
Absolutely, Patrick, and thanks so much for having me here. And I did want to start off by wishing everybody here on the call Happy New Year. This wasn't the way we were supposed to start the new year of 2022. I know I'm not the only one that likes to see 2021 in the rearview mirror. However, here we are, and we know that this is a caring community, and you can see the evidence of this by the people that are here giving their time and expertise to all of us in the community to not only to help us to keep safe, but to know what to do in this changing environment. We can't keep track of the number of changes and restrictions and what we're supposed to do or not supposed to do anymore. And so I'm very, very grateful to have this incredible team to step up and teach our community what we need to do. I have to say that as mayor of Cambridge, I get to go on to the calls every so often on Tuesday morning when the primary people running the Ontario Health Team get together on behalf of Cambridge and North Dumfries to do updates and to scan the room and to decide what we're going to do in the next week or two in order to care for our community during the pandemic. And I can't tell you, as a former healthcare worker, how important this team's been, the collaboration, the working together, the incredible partnerships that are formed, and the incredible help that everyone's giving each other means that our community is incredibly well served. I'm very proud of this team. I'm proud of the job that residents are doing to try and do their part to beat this. And I'm very, very much looking forward to hearing everybody this evening. So thanks for joining us. Thanks for having me.
Super. Thanks very much, Mayor McGarry. And to both the mayors and the kind words, I'll accept them on behalf of everyone working hard across Cambridge, North Dumfries to support our communities, the work we've done and the work that lies ahead. Let's go back to, I think there a slide. I just want to talk a little bit about what the Cambridge North Dumfries Ontario Health Team is all about. For that, if I take the next slide, if I could, for that. The government has made a commitment to move to creating Ontario Health Teams. And back pre-pandemic, we were announced as one of the early Ontario Health Teams. And what does that mean? It is an opportunity for the various service providers in Cambridge North Dumfries to come together and work together in a more integrated, seamless way. You can see on the slide the members we have. Mayor McGarry spoke about the Tuesday morning calls that we do, which brings our members and our affiliates together to talk about the system of care and how we actually work and support each other. Through COVID-19, we found new ways of operating and new ways of supporting each other. So whether it's been moving staff amongst our organizations or personal protective equipment, or at times providing ongoing support directly for any of our members, that's what you've seen happen in Cambridge North Dumfries. That's what's been working behind it in front of the scenes in order to make sure our community is as safe as possible for that. So the work of the Ontario Health Team isn't finished by any means. We're just starting the journey. COVID has tested us, and it's made us sort of accelerated the way you'll see the various service providers work together for it. We're proud of the work that we've done so far for that in the integration of care in terms of how we move and want to provide care in a different way. As I say, COVID's been a good test for us, and it'll help lay the course for the work ahead for that. With that said, and so keep in mind, there's, as you'll see on the slide decks, the footer always has ways to connect with the Ontario Health Team in terms of the ways that you can follow us on various social medias and channels, and our website in terms of just the work of the Ontario Health Team to keep in mind with that. And with that, I'm going to turn it over to Dr. Sharon Ball for an update on COVID-19 and where we are today.
I'm going to speak to you about COVID in our community. So the first thing is we are mostly seeing Omicron as our dominant variant at this point, really not just in Cambridge, North Dumfries, but in the region of Waterloo and in the province. And so really almost all of our cases are the Omicron variant. And what is Omicron? So remember, our experience with the COVID virus started early in 2020. And really, the COVID virus has mutated since. So as folks keep getting COVID infection, as it goes from person to person and continues to be transmitted, the virus actually can change. It can mutate. And it's just a protein. It can change its shape, and then that can change its function. And so some of those mutations make it more transmissible or less transmissible, more dangerous or less dangerous in terms of what it means for illness in people. The way we actually stop the mutation is by actually stopping the virus from transmitting. That's how it doesn't mutate. And so Omicron is one of many variants called a variant of concern. And the reason it's a variant of concern is it's more transmissible than many of the other viruses, and it can cause severe illness. So more transmissible was about 2 times as transmissible as chickenpox. For those of us who remember how contagious chickenpox was, Omicron is about 4 times more transmissible than the Delta variant. And so it spreads like wildfire anytime it has an opportunity. Illness, it can cause severe illness. There is a thought that this is a bit of a mild variant, and really that's not true. Now, it is 50%, I suppose, less virulent, less likely to cause severe illness and hospitalization than the Delta variant. Certainly, that's true. But when you're looking at case counts in the hundreds of thousands per day, and that's what we're looking at, it has the that means a lot of hospitalizations and potentially ICU, and we're seeing that in our province, and we're seeing that locally. Patrick Gaskin will speak to that, and so that piece is really important to communicate. And of course, we know Omicron is affecting all facets of our life right now. But with all of that said, we do have tools available right now that we didn't have before, tools that can blunt the impact of the Omicron variant. And so this is a slide that was shared by Dr. Shuli Wong, and it's available on the Region of Waterloo COVID dashboard. And it really speaks to what a difference we're seeing right now in terms of how many cases we have. And so if you look here at the pointer, this was the first wave. Blue is non-outbreak or community spread, and yellow is outbreak. If you look at the second, we had a second wave. We had a third wave. Actually, the region of Waterloo had a little bit of a blip when we had our Delta variant. And then finally, we have our fourth wave. And you can see how after that, Delta just took off in the beginning of December and just keeps going up. And really, at this point, we're off the chart. But as you may know, as of December 31st, we have really outstripped our lab capacity, and fewer folks are actually eligible for testing regardless, healthcare workers and essential workers only at this point. And so this is another way of showing how much Omicron we have. Is this just a one region problem? No, it's a provincial issue, really in every geography where you're just seeing that line go up almost straight. And so how do we know how much Omicron we actually have when we really can't rely on tests and cases anymore? It seems to hover around 10,000 a day, and we know it's way past that. We know that it's well above 100,000 a day at this point. We do have something called the wastewater signal. So in the region of Waterloo, the University of Waterloo has been doing testing on wastewater in terms of how much COVID there is in the wastewater all through the pandemic. And so that followed the waves quite closely. And we can see, as you can see at the beginning of December, how this just took off. 10 times higher virus in wastewater than we've ever seen before, Omicron, and really values that are just extraordinary. Again, validating the fact that there is Omicron everywhere. I'm going to get into vaccinations a little bit later, but I did want to emphasize still, we have tools in our toolkit right now that really can help support blunting the amount of Omicron we have in our community. I want to focus your attention on the two graphs on the right. even after 2 doses, and I'll speak to you later about the importance of the 3rd dose, but even after 2 doses, we see a significant difference with having vaccination versus being unvaccinated in hospitalization and in the ICU admissions by many orders of magnitude. And so this is from the Ontario Science Table, which is a really great resource. And this is actually language used by many physicians. And it's really the example of Swiss cheese. So in the face of COVID, no one action is perfect, not even vaccination, as important as that is. Think of each action: masking, physical distancing, trying to be in well-ventilated spaces, getting vaccinated. Think of each of these actions as a slice of Swiss cheese. Each of them has some holes where the virus can get through, but as you stack more and more slices, you kind of cover up those holes and build that wall. And so finally, what can you do? What can we do? Because it's a we problem. It's a problem for our community. We can definitely get our vaccines, really drill down on those 3rd doses and getting those that aren't vaccinated, like our ages 5 to 11 vaccinated. And we can also follow good public health guidance, which we know works. Wearing a well-fitted, high-quality mask, limiting indoor gatherings where we're close together and may not have as good ventilated spaces. Enjoy the wonderful outdoors. And if you're ill, if you're mildly ill, stay at home. And if you have concerns, call your healthcare provider, something that Paula Carrera will talk to you about shortly.
Super. Thanks very much, Dr. Ball. Very much appreciate that update for that. And now I'll take an opportunity to give you an update of what is going on within the hospital at this stage. For that, just to get a sense of the current state of COVID within the hospital. First of all, I thought I'd set a little bit of context for it, just to get you to understand, appreciate the COVID response we've done over the last almost 2 years. We have increased our intensive care beds, our ICU capacity. In previous waves, we went up to as high as 22 from our standard 12 beds. We're currently operating 14 beds right now. Similarly, our medical beds, over the course of previous waves, we've added extra medical capacity for that, and right now are operating 16 extra medical beds. We have hired more than 200 staff across the organization, supporting the COVID assessment center, more nurses, more environmental services staff for that, patient screening for that, et cetera, et cetera. There are opportunities for work at CMH. I'll speak about that in a moment. All through the pandemic, we have maintained the safety for patients and staff. The hospital is a safe environment. We have a stable supply of masks, face shields, personal protective equipment. If you need the hospital, it is a safe place to come for care. In terms of where are we at the current state of COVID right now, as of today, we have 4 patients in our ICU for it, and I've given you both the sort of the December 31st and today's statistics, just to show you, as Sharon said, how it's just changed so dramatically across the province, but then how to localize that context for you so that you can see what's happening here. Similarly, we've almost doubled our hospitalizations overall, even in the last 12 days. We've seen more cases through our emergency department for that. We have reduced services for surgery in some of our ambulatory clinics at this time. The government asked us to put a pause on those in order that we can continue to serve and address the COVID needs of our community. But we are continuing with cancer surgeries and urgent and emergent surgeries at this time. If you do have questions about your surgery or procedure, whether it's proceeding or not, please contact your surgeon or your specialist's office at this, to get the latest on it. And we have moved, in order to keep the environment safe, we have moved all of our visiting for inpatients to virtual visiting. We have a virtual visiting team deployed across the organization in order to set up virtual visits for inpatients and their loved ones. Over the course of the pandemic, we've even done one with a dog. The dog was not in the hospital, the dog was at home, and the patient wanted to connect with their dog. It was important to them, and we made that happen. I'll take the next slide, please. In terms of staffing, we're always recruiting. So come join the CMH team. It's an amazing organization and fun to work with. I thought I had to do that plug. We have about 100 staff today that are impacted with COVID. So that's either they are got active COVID or they had a high risk exposure at home or at work for that, and as a result they're in isolation, or they're having symptoms right now and we're waiting for test results for that. Daily, what we have been doing, what we do every day in this organization, we're doing it more amplified right now, is balance the needs of our patients with our available staffing for that. We have redeployed staff, our nursing staff, physicians, of our support services staff across the organization in order to support patients in medicine and ICU. And I give special thanks to all the staff within the organization, and particularly those that have volunteered for redeployment in order to support their colleagues in the units in areas that are particularly have the higher occupancies right now. And I'll take the next slide. We do have 2 units that are in a COVID-19 outbreak right now. And I've just given you the context of outbreaks in Ontario. On December 31st in hospital, there were 60 COVID-19 outbreaks, and January 11th, there were 3 times that in terms of the impact that Sharon talked about, the impact of Omicron within the system. All of our units are really operating at a high level of occupancy across most, if not all, of our units. And we have a group of patients who are waiting for care elsewhere, but because of outbreaks, whether it's in long-term care homes or some staffing challenges in other settings, that are waiting for care still at the hospital. And we are looking at ways to be able to move and try to get those patients into the most appropriate accommodation as quickly as possible. But it does impact the flow within the organization, and as a result of that, there are longer wait times at times in the emergency department because of that, because we're waiting for and trying to move flow within the hospital. Patients perhaps in the emergency department waiting for an inpatient bed. I'll take the next slide. If you're looking for more information about kind of the current state for that, I'd encourage you to visit the website for the hospital for that, where we've got how to book a virtual visit. If you're having a testing or you're coming to the hospital at all, there's information about that. We are publishing twice a week together with our hospital partners in Waterloo Region and Wellington County, an update in terms of a capacity report. I've got a picture of that on the screen. You can find that under the news section on the main portion of our website. Please follow us on the various social media channels in order to get updates of the hospital, or reach out to me directly, and I'd help facilitate any questions that you might have. And finally, on my last slide, I just wanted to thank a neighbor along Coronation Boulevard. There's a lovely sign that's appeared. It's a little bit hard to see. It says, "Thank you, CMH." And I know that's all extended to all of the first responders and all the healthcare workers across Cambridge North Dumfries in terms of the hard work that is going on to be able to support our community. As it's been said continually in the chat, please put questions in the chat. We're managing those here in order to be able to answer your questions at the end of the presentation. And I will welcome Dr. Dave Arnott to speak to you about assessment and self-assessment for that. Dave, turn it over to you.
Hi, everyone. So my name is Dave Arnott. I'm a family physician in Cambridge as well as North Dumfries. And for the last almost 2 years, I've been working at the Assessment Center in Cambridge as well as a number of other COVID-related roles. So over the last few weeks, there's been a lot of change regarding PCR testing, which is a test that you would get done at an assessment center or a pharmacy, or sometimes at a family doctor's office. Changes to the isolation periods, guidance around using rapid tests, as well as how to get an assessment when needed with COVID symptoms. Some of these changes have been based on more knowledge around COVID as well as the Omicron variant. And some of the changes are certainly based on a limitation of capacity and a bit of an overwhelmed system with limited resources for our healthcare system. So I'm going to try to give an overview of a lot of the changes and simplify some of the major things for each topic. It's not meant to include every single detail because that would probably take hours. So for a lot of things, I'll just provide you with some direction on where you can find resources as well, and kind of easier ways to navigate some of these changes. The other preface that I'll give is I'm going to focus on direction for most people in the general public. So if you work in a healthcare setting, or if you work in a setting that's considered a highest risk setting, so that would include long-term care, retirement homes, other congregate settings, then it's best to speak to your occupational health or manager if you have symptoms or an exposure to someone with symptoms. So I'll start off with self-assessment. I think most of us are aware of self-assessment in some capacity. It's pretty hard to leave your house without having some form of screening, whether it's at a restaurant or a public place with those screening questionnaires, or for workplaces with the self-assessment. And I think for a lot of us, and myself included, it just becomes so ritualistic that you sort of know what you're going to get as an answer when you're not having symptoms. But it certainly changed recently. So if you do have symptoms, or if you have an exposure, please go on and do the newer one, because things are a little bit different. It's pretty straightforward if you go through, and hopefully clear, and it gives you directions on what to do next. So I'll kind of highlight a few of the things that have changed a little bit on it. So there's a difference in symptom list, and it's important to note that even if it says you don't need to self-isolate at the end of it, if you're feeling sick, you still need to stay home. So let's say you just had a headache and you wouldn't hit two of those things in the bottom category. If you're feeling unwell, then you still have to stay home. And the main thing is that you have to stay home for your symptoms to be improving for at least 24 hours or 48 hours if you're having either vomiting or diarrhea. The other thing that you'll notice too on the self-isolation is a key difference in that the recommendation of, if you have symptoms, the whole household has to isolate regardless of vaccination status. So that's a new thing. And part of it is that, you know, it's definitely frustrating for a lot of families, especially for work and you know, those with young families where the kids are getting sick a lot. But Omicron is super contagious. So we're seeing it spread through whole households really quick, and a lot more than we used to with some of the other variants. In that before, if someone isolated really well when they got it, sometimes other people in their house wouldn't get it. Whereas now it's not often that we see that at the assessment centers. The other thing you'll notice, actually, if you can go back to the last slide. So the other thing that you'll notice is that it might tell you to isolate if needed and get tested if you qualify. So I'll touch on that a little bit, because that certainly changed a little bit later. But I'll just try to give you a little bit around the self-isolation, because that's changed quite a bit. So now if you have symptoms and aren't eligible for testing, you're assumed to have Omicron, and you have to self-isolate at home, as well as your family members isolating at the same time for the same period of time for how long you're isolating. So for people who are fully vaccinated or under the age of 12, you and anyone you live with must isolate for 5 days. If you're not fully vaccinated or immunocompromised, you and anyone in the household must isolate for 10 days. And so it might feel a little bit weird for people why, like even say someone in your house is immunocompromised and has to stay home for 10 days, why does the rest of the family? And part of the reason that they came up with these isolation times is really based on what they've determined for how long someone's infectious and contagious. So for someone who is young and kids under the age of 12, they actually clear it a bit quicker, and that's why they fit into the 5 days and can get out a little bit faster. For those who are over that age and unvaccinated, they clear it slower, and that's why the 10 days is stuck. If you're vaccinated, you actually do clear it quicker and are not contagious for as long as someone who comparatively is not vaccinated. So that's part of the rationale for it. The other thing that I'd mentioned that I think a lot of people aren't necessarily aware of is that if you have someone who's vulnerable in your life, or someone in long-term care or retirement home, and say you fit into that 5 days isolation, you still shouldn't visit them for another 5 days after, just because that's really someone who's a lot higher risk and at risk of infection. If you can go to the next slide. So another huge point of confusion, I think a big point of frustration for people, especially working at the assessment center, we see it a lot, and understandably it's confusing, because even for us, the changes are rapid and sometimes hard to keep up with. But on the 30th, there was a huge shift in testing guidance. And you know, a huge part of it just came from capacity issues. At our center, we had been booking about 250 people a day for testing. And we went from occasionally having extra spots to our spots filling up often in less than 10 seconds. So there were so many people who weren't able to get in for testing. We were at capacity, and unfortunately, a lot of people who needed testing or an assessment because they were ill were not getting in. So that's one of the reasons that they did that big shift, is because the testing centers were overwhelmed, the labs were overwhelmed. And once you have that start happening, the time to get the test result back becomes so long that it no longer becomes as helpful, because if it's taking 6 days for a test result to get back, you're already out of your isolation period, and really there's not that much benefit for contact tracing or from even ending isolation early. So the kind of the big message around the changes, though, is that most people won't qualify for a PCR test anymore. And it feels weird for people, I think, because for the whole pandemic, we've been saying, if you get symptoms, if you get exposed to someone, go and get a test. And, you know, with the way the guidelines have changed, getting a test doesn't really change that much for you. Because if you come in on, say, day 2 or 3 of your symptoms and you were able to get a test, there's still a few days before you get it back. So you're still isolating for that 5 days. Now, if you're not sure if you qualify for a test, there's the website ontario.ca/expose, and it will show you the indications for testing to see if you do need a test or if you do qualify for a test. If you can go to the next slide, please. So one of the other big changes recently has sort of stemmed out of the school initiatives and the businesses giving out rapid tests. So they're in a lot more households, and I'm sure a lot of people on this call have either seen one or maybe even have some in their house. So I thought it was pretty important to touch on these. The first thing I'll say is that these tests are definitely in short supply right now. They're generally not a necessary part of testing, and for most people won't significantly impact your isolation period. So if you can't get a hold of them or you don't have them, don't feel bad. It's not a huge difference. I know a lot of people want to know whether they have it, and I'll kind of touch on the accuracy of them. So the biggest thing I'd say is if you test positive on a rapid, you are positive. The rapid tests are highly accurate, with approaching 100% if you're positive. So if you are positive on the rapid test, you do have COVID. You don't need to go for a confirmatory test or PCR. You don't need to call public health. Isolate at home for either that 5 or 10 days, depending on what is most appropriate for your situation. If you're not sure, you can go onto that ontario.ca website/exposed, or you can call public health or your primary care provider for more direction. Where things are less helpful is when it's negative. So these swabs, if they're positive, are really accurate, but when they're negative, they're not as accurate. So up to 50% of people can have a false negative when they test on the test. It's a little bit better than that if you are really having a lot of symptoms or really feeling unwell. It will be a bit more accurate, but it still misses it almost a quarter of the time, even in that situation. So except in really specific circumstances, getting back that negative isn't really that much help. You can't use a single negative rapid to clear your symptoms as not COVID. It doesn't mean you can leave your house if you have that single negative rapid. You still have to isolate. And it's just because that false negative rate is so high. A couple other things I'd say, especially because they're in short supply, if you get a positive test, don't retest. It doesn't make any sense to, and it's a waste of test. If you're positive, again, it's not going to be a surprise. If you're negative, it's way more likely that test just missed it, because they're so accurate if they're positive. Can you go to the next slide, please? If you do have a positive rapid test or a positive PCR test, which is a test that you get at assessment centers, so self-isolate at home as soon as you can. Again, 5 days if you're over 12 and fully vaccinated, or if you're under 12, 5 days, 10 days if you're unvaccinated, immunocompromised, or if you work in a highest risk setting. The other thing that I'd recommend is isolating away from household members if it's feasible for you. Omicron spreads pretty quick, and so often we're seeing that, you know, in as short as 24 hours, someone can start manifesting symptoms when they get it from someone else, but it can take longer for sure. The other thing to mention is in terms of contact tracing. So you've probably heard that on the news, but essentially all it means is that for people that you saw in the last 48 hours, either before you tested positive or your symptoms started, whichever one's earlier, those are people that would have been at risk of you giving COVID to. So it's important to let those people know that they were exposed, and what counts as being exposed is spending over 15 minutes from them unmasked within 6 feet. So if you were outside sitting 15 feet away or talking from the end of the driveway, that doesn't count. It's really those closer prolonged times without masks that count. And then again, you can send them to that same website, ontario.ca/exposed, and it will give them direction about whether they need to isolate and things along that. So again, though, like if you have symptoms or if you're positive, everyone in your house has to isolate for the same amount of time that you are isolating. You go to the next slide, please. So the other part I want to briefly touch on is assessment centers and testing. So as I mentioned, testing has really changed, and most people do not need a PCR test or would not be eligible for it. So a lot of the assessment center, we've been shifting towards seeing sick people, and particularly those with moderate symptoms. And Paul is going to touch a little bit about what that means and when people should come to the assessment centers. So in our region, we have a few different assessment centers. In Cambridge specifically, we have the Cambridge Memorial Assessment Center, where you can get tested if you're eligible, but as well, if you're feeling ill, but not at the point of going to the hospital, then we can provide assessment from nurses as well as physicians and provide treatment if necessary. We've certainly been working long hours there and over the last 2 years, so please try to be kind to us. There's a lot of changes that happen. It's overwhelming. I know it can certainly be frustrating at times, especially if you feel that you really need a test or someone's vulnerable in your life. And certainly, you know, I've tried to voice it doesn't really change much for you, and certainly you should be careful if you have symptoms or if you know you swab positive on that rapid, of seeing people even beyond that 5 days who are vulnerable. Like, you really should wait 10 days before you see those people. So yeah, that's all I really wanted to touch on. I put those 2 links there. It shows the assessment centers in our region as well as other testing options across Ontario. Certainly things are likely to change in the future, both around our assessment centers and testing. So kind of the best way, if you're not sure or if you get symptoms, is go to the Ontario website and plug through those self-questionnaires that will give you more direction. So thanks for listening. Hopefully that provided some insight and summary into it for clarification, and look forward to answering any questions.
Super. Thanks very much, Dave. And a number of questions came in during your talk, and that we'll get to those during the Q&A. So again, to remind people to keep those questions coming for that. And I'd like to welcome Paula Carrere, who is the clinician lead from the Waterloo Region Nurse Practitioner-led clinic, to talk to you about what to do if you think you've got COVID. First of all, Paula, I understand you had a birthday today. You turned 10.
That's right. That's right.
Now,
we did.
People on the call will say, Patrick, Paula's not 10 years old for that. The Waterloo Region Nurse Practitioner-led clinic celebrated 10 years today. Today, is it?
Yes,
today,
that's correct. Yes, that's
from
correct.
Your first patient. Why don't you speak a minute or two about what that has been and what an amazing accomplishment that is, how you're serving the community for that, and then tell us what to do when we've got COVID.
Oh, great. Thank you very much. Yes. So 10 years ago today, Waterloo Region Nurse Practitioner-led clinic opened for primary care to serve residents of the community of Cambridge who did not have access to primary care for various reasons. We started with a team of 8. We are now a team of over 20, looking to expand even further. We are an interprofessional team with nurse practitioners, social work, pharmacy, and wonderful physician collaborators. And we are very pleased to be able to contribute through the Cambridge North Dumfries OHT to the COVID response and to planning for care in our community as we move forward. So thanks very much for recognizing that. I shouldn't have told Christina. Thank you. So with Omicron being 8 times more transmissible than chickenpox, which I do remember, and people all around us, I'm sure everyone in the virtual room knows somebody who's had experience with symptoms. It's not uncommon for any one of us to kind of wake up in the morning and think, oh, what do I do now? I have a cough, I have nasal congestion, I have fever, or I have a sore throat. You might be tempted to run to the computer and do the self-assessment. That is a great idea. You might also be tempted to try and reach an assessment center and get a test or do a rapid test at home. And Dave has outlined kind of the merits of rapid testing and the whens we should do that, and really helped us recognize that you really don't need a test to draw the conclusion that you are going to probably transmit an infection to someone, and you'd be wise to stay home. So just as a review, mild COVID. So COVID is a constellation of symptoms, pretty much always including fever, muscle aches, loss of smell or taste. Many of us have heard is a characteristic sign of COVID. It is not something that's required. None of the symptoms are required. As Dave mentioned, you can have one of a category of symptoms and 2 or more of another category. If we look at it as mild, moderate, and severe, many of us have those cold kinds of symptoms and do fine with symptomatic treatment at home, managing our other diagnoses, for example, like asthma or diabetes, with our standard therapies. But if we experience things like increasing shortness of breath, dehydration, which would be things like dry mouth, not urinating enough, feeling very weak, or mental changes such as confusion or extreme fatigue, then it's time to seek additional care. We define severe COVID, and these are fluid definitions, as moderate plus worsening signs of breathing problems, dehydration, and or signs of shock. So for the broad public, signs of shock would include things like clammy skin, blue lips, and again, extreme weakness. Chest pain would be another thing we would be looking at, or you would be looking at home. Next slide, please. So treating mild COVID is very similar to treating the flu or a cold or another upper respiratory tract infection that you might have. The first principle, the other speakers have outlined it, is stay home and stay away from other people. You should be in your own room. You should be wearing a mask if you are interacting with other people in your home, and you should be cleaning surfaces that are commonly used. You should be cleaning them pretty diligently. You can treat symptoms with the standard therapies. Honey and lemon do work super well. There is evidence for it for a sore throat. You can use fever reducing medicines, although the reason for doing this is to improve your comfort, not necessarily to reduce the fever. You can use cough medicines and decongestants. So rest, fluids, other home remedies, chicken soup, keep your hydration up, and hopefully within 5 to 7 days, you will be back on the mend with mild COVID. If you have more significant symptoms, and specifically we would look at, again, that dehydration and breathing problems, so your puffers aren't working if you're an asthmatic, then we would encourage you to head to the Cambridge Assessment Center. And there you will meet a team of doctors and nurses who can do a thorough assessment, make some recommendations, perhaps do some diagnostics like a chest X-ray, and further develop a treatment plan for you. If your symptoms are super concerning for you, if you are feeling like you're going to lose consciousness or your family member is going into shock, then clearly you belong in the emergency department. And as Patrick said earlier, the emergency department is open and ready to welcome you, and in spite of the challenges that all of our systems are having. So we would expect that you go there. At any point in all of this, if you have questions, we would encourage you to ask your healthcare provider. You can use telehealth. You can go online and look at the public health website for directions around what next steps to take. But probably your best bet is to reach out to us. So that's 2 minutes worth of how to manage COVID. Thanks very much.
Super. Thanks very much, Paula. And again, happy birthday. Thanks for the service that your group has provided for that. I can't believe it's been 10 years for that.
Yeah.
It just felt like yesterday for that. So I would like to welcome Helen Fishburne, who's the Chief Executive Officer of the Canadian Mental Health Association, Waterloo Wellington. And Helen, we've all been through a tough time for that. How are we going to get through this one now? We're looking for some help, some support, some thoughts, some inspiration, some ideas for the next step. Over to you.
Yeah, thanks so much. So I am really honored to be part of this amazing panel, and we've worked so closely together through the pandemic. Tonight, my part of the discussion is to really talk about the mental health impact. You've heard from the panel tonight that many people are impacted by Omicron. Many people are contracting Omicron. But tonight, the mental health impact is even bigger. In fact, although my data isn't scientific, my projection is based on what we see and hear and feel every day. And that's that every single one of us has had our mental health impacted by this pandemic. Literally, I mean 100% of us. So let's break this down. Go to the next slide. It's been an exhausting year, and not just for those of us in healthcare. Every single one of us has been disrupted, frustrated, exhausted, discouraged, and frankly, fed up. The impact goes even deeper for folks who are vulnerable, who've struggled with anxiety, depression, problem drinking, and have had dark thoughts. Next slide. We all handle our stress differently, but it has been pretty common to see folks struggling to regulate their emotions through this pandemic. Some people cry all the time. Others have had angry outbursts for seemingly no reason. Dark feelings can creep up on all of us. And before we know it, we're losing our patience with our kids. We're lashing out at our partners or snapping at the cashier at the grocery store. Sometimes we're also withdrawing from the people we love. So there's been some new words coined to describe how we feel through the pandemic. I don't know if you've heard of PANGER, which is pandemic-induced anger, or Panicron, which is Omicron-induced panic. It's all very real and certainly very understandable. And here's the best news. It's all treatable. Next slide. There's been some real ups and downs through this pandemic, but let's just call it and admit that this last wave has hit us the hardest and the deepest. And there's really two reasons for that. The first is that we didn't expect to be here. We've had a measure of confidence and comfort with our high level of vaccinations in the community. We've done so well vaccinating our community, and we were really feeling like we were almost at the finish line. In fact, we could almost see it or touch it. And then Omicron hit us, and it feels like we've gone right back to the beginning of the race. And keep in mind that we had almost finished running a marathon. So now we're back at the start line. So no wonder people are feeling exhausted and frustrated and fed up. And some people are refusing to do it again. So the second part of that is that, as you've also heard from the panel tonight, the Omicron has also changed the race for us. This is not the race we're used to. The rules have changed, and we're having to shift and adjust very quickly at a time where we're mentally and physically drained. The challenge is that many of us aren't willing to follow those rules because of that exhaustion, not because people don't want to or they don't get it, but they are just so tired. And that can really have some challenging consequences, both individually and collectively. Next slide. So although that sounds pretty depressing, and it is, it's honestly felt that way at times, in mental health, the first thing we need to do is to be real and be honest and to call it. So once you have that level of awareness and understanding, you can start to shift your thinking and your behavior. Even in these very tough circumstances, I am here to tell you that there is lots that you can do to get through your panger and your panicron and just that level of stress that you're carrying. You will get to a better place. So I'll just mention a few things that can help. Next slide. First thing is most important is to stay grounded. As you can see, this beautiful tree has deep roots, and the roots keep the tree from blowing over in a windstorm, and it breathes life into the tree. Like a tree, we also have roots, and those roots keep us grounded and functioning. A key to staying grounded is to increase our own level of self-awareness, which has never been more important. To manage our own level of stress and worry and tension, we all need to be aware of what we're carrying and to actively do things that keep us grounded. And I don't just mean like once a week, but really every day, especially right now during these uncertain times. Be in tune with yourself and know what you're feeling. Things like focusing on gratitude and maintaining perspective are two really important grounding tools. Next slide. So going back to my marathon analogy, we're at the start line again. So we need new shoes. We can't run another race on shoes that have no sole and no support left in them. Translating that into the mental health context, we have used up our own level of personal resilience. Kale and smoothies and candles, they're all awesome, but we're well past that now. We have to add new tools to our toolbox to deal with this very challenging wave. So if you think about how you're coping, consider using supports and tools that you've never tried before. Think about the new shoes you'll try on. There are many tools that you can use to manage difficult feelings right now, and certainly coping with the uncertainty. And that leads right into the next slide, which is an absolutely essential rule right now. No matter what your situation is or what your level of coping, please don't sit with those dark, negative thoughts and feelings on your own. There's absolutely no need for that, but I can tell you that the silence only compounds that darkness. This is the best time to reach out and to also reach into folks that you're worried about as well. There's been this silver lining in the pandemic, and that has been the renewed compassion and empathy for mental health that has come with many people for the first time feeling anxiety and depression. They finally get what that feels like, and we've been able to break through some of that long-standing stigma in mental health. We've seen incredible kindness, generosity, and courage, and we've all become so much more open about our mental health. Let's talk a little bit more about how to do that now with some local resources. That's the next slide. Here's just a quick list of things, and in Here 24/7 is, of course, the most common one. So within Here 24/7, we really want people just to be able to call us any time of the day or night. There are amazing service coordinators there. They can connect you, whether it's within the Here 24/7 family or to a family doctor or to a counseling center or to an EAP provider. If you're not sure who to call, just call us at Here 24/7 and we'll connect you. And it is so important to know that Here 24/7 is our crisis service as well. So we're really connecting with people who are in that immediate stage that they need that intervention and support right away. Next slide. We also have an incredible website that we've put together called Here for Help, which is at hereforhelp.ca. It's got all kinds of resources, links to virtual care. We have some amazing programs out there to help people. You don't even have to leave your home. You can call us anonymously. You can register for programs. We've really tried to remove every possible barrier to get people the care that they need. Next slide. I just want to give you one example of that, and that's the Bounce Back program. The Bounce Back program is a virtual program. You get a workbook, you identify a goal, and then you get a phone coach. It's all free, and it's super, super helpful. On top of all the other resources in our community, There's an amazing service at the Cambridge Memorial Hospital for mental health services. Your family doctor is an incredible resource. There are counseling programs. There's all kinds of services and programs. And I think the most important thing, again, is that we really don't want people to sit with that silence and those difficult feelings, which takes me to the last slide. No matter what in mental health, no matter how hard the waves have hit us and taken us back, we have to remember that we've made some amazing progress in fighting COVID over the past 2 years. Our high vaccination rates and our ability to have open and really productive mental health conversations are just examples of that. So we have to really continue to focus on the things that we're proud of from the previous year and the things that we've tried, as well as embracing new things to try. In mental health, there's nothing more important than hope, as it allows us to see and hang on to that belief that things will get better. We'll experience that joy again. Hope pushes us forward and out of the darkness. So feel free to hang on to each other a little tighter, hold on to that hope, and know that you're not alone. We're certainly all in this together. And I hope you get that sense in our community, which is really rich with incredible supports and resources.
Fantastic for it. Thanks, Helen. I think it's really important that people reach out. Just as a quick aside for that, we had our medical advisory committee meeting tonight. Our interim chief of staff, Dr. Lee, and all the chiefs of the various departments meet, and virtually, of course. And she talked about the importance of her connecting with them and them just connecting, having a coffee with their department members, say 2 meters apart, and all that sort of stuff. But that just importance of reaching out, reaching out.
It's the simple things, right, where you feel like you're getting that you're a part of that support system, and in some cases a safety net as well.
Yeah.
So it's simple. Sometimes it's harder for people to do, but in this climate, we all really need to do that.
Absolutely. I think it's really important. Thanks very much, Helen. I know you'll be available for the Q&A, reminding people to provide those Q&As. We've got a number of them already, which is fantastic for that. I'm going to go back to Sharon on an item for that. I think we kind of went over vaccines a little bit more quickly than we might want to have, Sharon, and I'm hoping you have a little bit more to share with the group about the importance of vaccinations for that. It's also some of the questions coming in may help us even begin to answer those.
Thanks so much, Patrick. So really the key points I'm hoping in this vaccine update to articulate is that vaccines are safe, vaccines are effective, and vaccines are available readily across Cambridge, North Dumfries, and region of Waterloo. So really want to encourage us to get vaccinated now. The benefits of vaccination, of course, is that we protect our community, we dampen the curve with respect to Omicron, and really that we get that ability to get back to some sort of normal where we can connect. Remember, it's important to protect ourselves and protect others. And that means those who are youngest, who are not eligible for vaccination, as well as those who are more vulnerable, like our immunocompromised and our older adults. So the 3 takeaways I'm hoping to emphasize are the excellent protection that you get from the Moderna vaccine, which is plentiful. The importance of 3rd doses now, just considering where we are in our pandemic, how briskly those Omicron COVID cases are going up, and just leaning into the fact that it takes 2 weeks to get full protection from a dose. And then finally, our need to really vaccinate our youngest. So first, vaccines are safe and vaccines are effective. All of our vaccines are approved by Health Canada. Everything that's available in Ontario, anything that you would be offered, we know is safe and efficacious. It provides protection from severe illness, hospitalization, ICU admission, and death. The second point is very important. Both of our mRNA vaccines, Moderna and Pfizer, are interchangeable. As somebody who's been practicing since 2004, I have never, ever been asked when someone comes in for their tetanus booster about a particular brand, when someone comes in for their flu shot or their whooping cough vaccine. I mean, it's always give me the vaccine against the illness. And remember, these are COVID vaccines. And that's really how we should think about them. The branding piece is much less important. Evidence again shows that each of them are effective and the combinations are effective. So if you've had an AstraZeneca and then a Moderna and then a Pfizer, they're all efficacious. The Moderna actually has likely some added protection in some real world studies recently. So key point is whichever vaccine you're offered, wherever you're offered it, in primary care and pharmacy and community pediatrician offices and public health, and as soon as you can get it, please lean into that. And so Region of Waterloo has released almost an extra 30,000 appointments yesterday. And, we really are encouraging everyone to book now. And if you have an appointment later in the month, please rebook earlier. Because remember, this is actually a race against the variant. Timing is essential. To get that protection, you have to be 2 weeks after your last dose. So get vaccinated now. And how to book, this will be put into the chat and on our website as well, but there is a website as well. If you don't have computer access, that's okay. You can ask any of our regional libraries to help assist you in booking an appointment. You can ask friends, neighbors, family members, your primary care office. We've helped loads of people sign up, as well as calling one of the phone numbers below, which have services in many, many different languages and services for those who are deaf and hard of hearing. One thing I want to note is it's very common when there's a new medication, let's say a blood pressure medication that you might be starting or that you've started, a new therapy, a new immunization, to have questions. That's very normal, right? You wonder about the data, how it will work, what side effects you might anticipate. You may have questions about why you need an extra dose. I really, really want to emphasize that those should not be barriers to actually getting your vaccine. If you have questions, please remember that that's what your healthcare professional is there for. We have the answers to these. We have data that we can provide you, hopefully reassurance we can provide, information for you to take home and analyze so you can make an informed decision. So remember, ask us. That's what we do. In terms of side effects of the vaccine, they're mild. When you get your booster, the third dose is not much different from the second dose in terms of side effects. It's really feeling slightly bad, maybe with some aches and pains, maybe some soreness, stuff that you can take water, a bit of Tylenol for. Remember, that's discomfort for a day or two or three, but it's to build immunity for a very, very long time. And third doses, we know that even with 2 doses, you do have good protection against the most serious outcomes. So those top orange and yellow lines speak to hospitalization and ICU, but you get more protection after the third dose, and especially when it comes to actually getting Omicron. So the protection after 2 doses really drops off with Omicron. And it's really that third dose that you need to boost up that protection very significantly back into range. And so I showed this slide briefly to Patrick's point, but really just want to emphasize here how important it is to think through the difference in vaccination rates, so unvaccinated versus vaccinated, for the most serious outcomes, and that includes hospitals and ICU. And finally, kids age 5 to 11. Kids are absolutely at risk of COVID also. It's true that most kids usually will have mild illness or be asymptomatic, but there is a risk of severe illness, hospitalization. So while it's rare, it definitely isn't zero. We know that COVID can cause serious illness in children, complications in children. We have been seeing increased rates of hospitalization, including ICU admission in children in the last few weeks. We know vaccination protects kids in this age group. And unfortunately, only 47% of kids age 5 to 11 have received their first dose in our area. And we've had very little second dose in this age group. So we really, really want to encourage parents, if you have questions, kids, if you have questions, to ask your healthcare provider. And so this is from Unambiguous Science. I really love it. It gives me a lot of joy to share this with families. So 6 reasons for getting kids vaccinated. We know the first, it protects us against serious illness. It protects us from long-term effects of COVID, including a very serious complication that is multi-system inflammatory syndrome, kind of a fancy name, but something that can cause hospitalization. We also know that on a population level, like if we take everybody, all kids, the risk of severe COVID is low, but we don't know which child that's going to be. And we don't want any child to go through that. The fourth one, it gets kids back doing the things that they enjoy. Really want to emphasize the fifth piece is that the benefits of vaccination far outweigh the risks. And the last piece is it is our pathway to normalcy. So again, vaccines are safe, they're effective, they're readily available, and we really encourage you to get vaccinated now.
Super. Thanks very much, Sharon, for that. That was a great overview for that. And if I had a kid 5 to 11 that hadn't, you'd convinced me for that. You didn't say anything about free ice cream or anything like that for that, but I know they've been doing some fun things at times at the various vaccination centers to welcome and encourage and make it a safe environment for children. Maybe Sharon, I'll ask the first question because I'm going to ask it to you because I saw it. I think it was one of our early ones that came in about seeing Omicron in wastewater. So as I call it, can you give us the scoop on poop? Because I think what the person was saying was, what do you mean it's in the water for that? And so I think we want to assure the public around a safe water supply, even though we're not water experts for that. But do you want to say a little bit more about Omicron in water?
Between my slide glitch and that little audio clip, I think I would be in pretty bad shape not being invited back ever. So certainly the way of thinking about wastewaters is exactly that. So wastewater is really the stuff that we flush down the toilet. And so that is analyzed and part of the virus is extracted for analysis and so on. But for sure, I want to assure the community while I have the mayors looking on of Cambridge and North Dumfries that just like everything, our water is treated, purified, it's completely filtered, completely safe for drinking. So really emphasizing the wastewater part of that.
Super, thanks, Sharon. So when in doubt, we got the scoop on poop from Dr. Ball here for that. So thanks very much. I think it's really important for that. A wonderful marker and indicator. It's so interesting that the region put that in place early to be able to do that. So congratulations to them. I know a number of communities across Ontario and across Canada have been doing that. I think there is a future in kind of our wastewater management. We'll be excited to see what can transpire from that. Sharon, as you look through the chat, is there a question you want to pose to one of our panelists for that, or do you want me to ramble and you'll find one for that?
You never ramble. I do have one that I think is resonating with me, and it's really for Helen. How can I best support my health, myself and my children's health with respect to return to school? Just feeling very anxious, and I think it's very timely. Because that, of course, has been the hot topic. And we did have the announcement from Minister Leite as well today. So over to you.
It's a great question, Sharon. And we are getting a lot of calls from parents that are very concerned and with reason, right? Omicron is very transmissible. There's high transmission rates in the community, and schools are a microcosm of the community. So everyone wants their kids to be safe and have a good experience at school. So I think what's most important is just to take a really calm and grounded and reasonable approach. Going back to school on Monday is not going to be a perfect experience. We know that. However, schools have been working really hard with the government to put some safeguards in place between HEPA filters and masks. Today, there was an announcement around some possible vaccination clinics on site at schools. Again, a great step forward. It's really important as parents for us to prepare our kids to go back to school and to know that they're going to be able to manage whatever they can in the day. So we want to give them a sense of confidence and comfort to know that they're going to be okay, they're going to manage their day, and walk them through what to expect, how to manage, how to deal with this situation, how to deal with that. Like we do in everything with mental health, put it on the table, talk about it, and just make it part of your day-to-day conversation as you would what they're wearing to go to school, or have they got their homework done. You're preparing your child mentally in the same way. As a parent, you also want to make sure that you're staying calm and not, projecting your anxiety and worry onto your child needlessly. If you're feeling really overwhelmed and stressed, call a friend, call a family member, call your family doctor, call us at Here 24/7. We have parents that call us in the middle of the night because they can't sleep. And that's what Here 24/7 is for. They're ruminating in their minds and they're so concerned. Pick up the phone, call us, we'll walk you through it, and we'll really help you manage. There are really practical ways that we can help you manage your anxiety. So try to stay calm, follow the rules, public health guidelines, and know that although it's not perfect, there's some really good people working really hard to make schools safe.
Super. That's a great answer and some great advice for our viewers. Thanks very much, Helen, on that. Dr. Arnott, I've got a question for you that's come in on the chat for that. A question about whether or not, if you get a rapid antigen positive test, how you should handle the Canadian COVID app. Do you register that? What advice do you have on kind of recording that as a positive on the COVID app?
Yeah, so it does count as a positive, so you can register it on the app as a positive. Things have changed a little bit in terms of high-risk contacts and what that app means. So you can still use that ontario.ca/exposed if you do get a ping on your app. But yes, you can put in a positive rapid test.
Okay, super. Sharon, anything in the chat that you're monitoring that you want to throw to one or handle yourself?
Well, I think in terms of the testing theme, there were some testing questions, so maybe we can follow that up. One is really, what happens if my child is exposed at daycare or school? Will they have to stay at home?
Sure, I can answer that one again. So I'll probably piggyback a little bit on Helen's answer too, just to kind of put a little bit of background on what schools are doing and what changes have happened. So one of the big ones that I think parents will probably be happy about is public health and the ministry's indicated that they're no longer going to do put off a cohort. So if someone's positive in the class, they're not going to put off the whole class. That being said, the same rules still apply. So for those who are high-risk contacts who are not household, they will not have to isolate. If someone has symptoms, then they still have to isolate like normal. So one of the other questions that kind of came up in the chat is if your child gets sick, what does it mean? And so it kind of falls to those symptoms, and certainly running through that algorithm will give you more information. But if they do meet the criteria for isolation, so if they have one of those symptoms, including fever, cough, shortness of breath, deep loss of sense of smell or taste, or two of the other symptoms, which is runny nose, headache, extreme fatigue, sore throat, muscle ache, or vomiting or diarrhea, then they're going to be off for that 5 days. The school is working, and I'm sure there will be some announcement in the coming weeks on some other methods to try to get kids back to school quicker, both for means of PCR testing as well as for potential rapid test distribution for some of those indications. So yeah, essentially if they have an exposure, then it's really, you'll get some more direction from the school, but you might not necessarily find out about that exposure, and there's no more cohorts being put off.
Dave, can you run by those symptoms again? You talked about kind of if you had one of, those sound like more serious than versus, you got the double whammy, two of. Can you help bucket that? Because there were a number of questions in the chat. What if my kid has just a runny, like kids have a lot of sniffles and things like that, and is everything COVID? Can you just kind of parse that out again for the audience?
Yeah, for sure. So part of the reason they broke it down is because if you have one of the bigger symptoms, in that if you have a fever, cough, shortness of breath, or loss of sense of smell or taste, those are a lot more likely to be COVID-related symptoms. And that's why if you have a single one of those symptoms, that they're treating it as presumed COVID and putting you off, versus the other ones, which still definitely occur with it. And we're seeing it a lot where even those are in isolation for people who are swabbing positive. But if you have one of those symptoms and your kid's not feeling well, they still have to go home and stay home, but they don't have to do that same 5 or 10-day isolation. And once they're feeling better for 24 hours, they can go back. So essentially, Patrick, like the other aspect of it too is that for each of these, it's really new or worsening cough. So if your child has something like asthma and is coughing every week and there's no change in that cough, it doesn't count. Or for example, if they get daily headaches, that it doesn't count if their headaches haven't changed. So really going through that algorithm online, you can kind of notice and it will give you direction based off those things of whether you actually have to stay home or not, and whether it's isolating for that time or whether you can just go back once you're feeling better.
Okay. Thanks.
If I can for a second,
Sure,
there's a
Mayor
really
Foxton.
good question here. And it says a family member tested positive, had symptoms. 2 weeks have passed. They are now feeling better and have no symptoms, but test positive. What does the family do? What do they do? What a great question. Great questions, folks.
Yeah, so the answer is essentially stop testing. And part of the reason is that even though, like, once your symptoms resolved and once you're outside that isolation period, you're not considered contagious anymore. However, the way that these tests work is one of 2 ways. So the one that people get done at the assessment center, the problem with it is that you will swab positive, potentially even for months. And it doesn't mean that you're still contagious, but it can pick up dead virus from the back of your nose, and it will still show up as positive. Similarly, the way that the rapid tests work, it can still show positive even once you're outside of that isolation period. So if someone in your household tests positive, is feeling better outside that isolation period, don't waste another rapid, because it very likely could test positive again. If you're in a situation where you get a positive and then pass your isolation, your kid goes back to school, gets sick again, then it's really best to kind of isolate that kid at home, talk to a healthcare provider, talk to public health, because those are really specific scenarios where if someone's really recently tested positive. So bottom line though is if you're feeling better outside of the isolation period, don't test, because it is a high likelihood that you could come back positive, and it does not mean that you're still contagious.
Okay, so one lady put on that she tested positive 5 times in a row. She shouldn't have ever tested after the first time. Really good information. Thank you.
Sharon, I see a question in the chat for you that I think would be fantastic for you to answer about my 8-year-old's scheduled for a second dose next Saturday. That's the original minimum period for that. Should I be moving that up?
Yeah, that's a great question. So with the 5 to 11, you're absolutely right. When we did first doses, we would call back kids, even in primary care, as an example, at 8 weeks. But for sure, we know that you can follow manufacturer's directions, which for Pfizer really would be as early as 21 days, 28 days, probably a bit more common. And so that just requires parental consent. There's nothing wrong with that. And actually, on balance, many are doing that and others aren't. So sometimes folks are waiting the full 2 months, the idea being that we have seen with other age cohorts that if you space out the vaccines a little bit, you can see a longer lasting immunity. On the other hand, you have to look at the place on the ground right now that we're in. And so many folks are, and I know many physicians in the community, clinicians in the community have actually done this themselves and been quite public about it, just kind of going in earlier. So you absolutely can get vaccinated earlier. And I mean, I think it's a personal decision. Ultimately, you can say that to the pharmacist, the primary care doctor, the public health clinic, wherever you're booked in for the vaccination, and you can move it up.
Okay, super. Paula, can I put this question to you? There's it says, what about if you have had an exposure, but you've got no symptoms? Do you need to isolate and test, or isolate and test if only if you have symptoms for that? So if you've had an exposure, what do you do? If
you've had an exposure, you don't need to isolate unless you have symptoms at this point.
Yeah, so the only sort of caveat that's changed a little bit, it's easy because there's a lot of scenarios that can happen, and certainly the Ontario website's captured it fairly well. So if you get an exposure, just go to that website, ontario.ca/exposed. But for context, Paul is right. So if you're fully vaccinated and have no symptoms, don't live with the positive case and are otherwise healthy, or you're under the age of 12, then it's really just keeping an eye out for symptoms and don't visit any high risk settings for 10 days. So don't go to a long-term care, don't go visit someone who is at higher risk, like someone who's a senior or immunocompromised. If you're not fully vaccinated or if you're immunocompromised, then you actually do have to isolate for 10 days after your last exposure, regardless of whether you had any symptoms. And then the only other thing that would change it too is that if you work, live, attend, volunteer, or you're admitted in any of those highest risk settings, so hospitals, long-term care, retirement homes, congregate living settings, then that's a different story, and you should really check with your occupational health. So sort of the two scenarios where you'd have two common scenarios where you'd have to isolate is if you're not fully vaccinated or immunocompromised, or if the person's living with you. So if you're fully vaccinated, in that case is exposure living in your household, you still have to isolate for their duration of isolation.
Super. Thanks, Dave. Thanks, Paula, for that. It's a complex one. Now, there was a complex question in there about congregate living and residents testing positive, and then maybe a day or two later, another resident tests positive, and the facility is in outbreak, and that's restricting visiting and restricting, causing residents to be, socially isolated for that. Kind of any advice on how long? I realize that's kind of a home-specific issue, but is there any sort of broad advice that one of our speakers might want to give to the individual? Obviously, really tough for their loved one who's in that community setting, and the outbreak is continuing. Dave and Sharon both came off mute, and and they're on either side of my screen. Eeny, meeny, miny.
Go for it, Sharon.
I was going to say it really is actually up to public health and long-term care homes. So I think anything that we said beyond that probably would be too broad. There's no doubt, however, that there's some complexity, right? In congregate settings, they're higher risk. Sometimes if there is a case, like there's a couple of cases, the whole place goes into outbreak. And so that changes things. So it's quite a different scenario. What is really disheartening, you're right, is sometimes these outbreaks last a long time. And, as you have different staff who may be positive or different folks that may be positive, that kind of resets the outbreak. And also, again, people can become high-risk contacts. One thing I would say, being involved in this space through all four plus waves, is that the nursing homes, long-term care homes, senior living facilities have always been good, but boy, they've gotten so much tighter and have more built-in expertise. And I actually think part of me, when I think about this scenario, my heart does go out to the residents actually who are going through this isolation, and really to the families who feel kind of locked out, and feels like, again, Helen was saying, that step backward. So you're right. There's a bit of complexity to that. It's not an individual risk. It's really a home risk and a home area risk. And so public health and long-term care do really work hand in hand in our community together, along with support from the OHT.
Super, thanks, Sharon. And we've been given the cue about the hook that we're getting. Sharon, I was as a co-facilitator for the Q&A for that. I'm just going to pass it over to you to wrap it up and for that.
Can I ask one question before you do, Sharon? Is there any way you can do a point form little cheat sheet that we could put on social media, and then put the links that Dr. David has talked about, and get that out to the people? I think getting those links out and point form points, really are easy to see, not paragraphs or sentences. Questions are great. Thanks so much for doing this, guys. You had 60 odd people here tonight, and we want to get even more people updated.
Super. It will be, I'm going to pass it over. We will absolutely take that back to the Cambridge North Dumfries OHT team and look at how, so following those on social media for that and other ways to get that information out. Sharon, over to you to wrap us up.
Yeah, I really, again, just want to thank everybody. I know it's an evening in the middle of the week. I know all of us are exhausted. You don't know what you're going to get when you hear about the CND OHT panel crowd. Hopefully, we were able to meet your needs. The Ontario Health Team is very committed in terms of listening, trying to gauge where residents are, how we can best suit them, how best we can suit their needs. And so it's very important to us to be able to put on something like this. Hopefully you found it helpful. The slide that's being depicted here shows our website, and we really encourage you to follow us on social media for more information. Hopefully you found this helpful. Just really want to thank my co-facilitator, the wonderful Patrick Gaskin, as well as our panelists today. Really, we want to ensure that you feel comfortable and armed with the equipment. So yeah, thank you to everyone. Thank you for attending.